Our guest today is Dr. Anna Mirk. She is a veteran. She is an internal medicine doctor, and she further specializes as a geriatric medicine provider, working largely out of our Atlanta Birmingham Veterans Administration Center. And she's going to talk to us today about polypharmacy. And it's like, well, what is polypharmacy? Well, it's lots of medicines, policy, pharmacy, medicines. And as we get a little older, many of us who have multiple medical disorders will be on multiple medications. And sometimes it's really important to understand what we're taking and what the likely side effects are going to be, because even if you're taking your medications as prescribed and in the way that you should as an older adult, you may develop an interaction. Dr. Mirk is going to tell us what that is, why that's important, and what we should do if we feel like our functioning is a little different as a result of our being on the different medications. Don't do this by yourself. You got to do it in consultation with your doctor. Dr. Mirk, you're on mute.
Thank you so much, Dr. Parker. Really nice to see you. And thank you so much for inviting me today. I am at the Atlanta VA right now and hoping that with all these storms, the power doesn't go out in the middle of the presentation. So we'll cross fingers for that. I'm gonna try to share my screen here. Let's see.
Okay, we got it.
Not working now? Can you see that title slide there?
Yep, polypharmacy in the older adult.
Perfect. Okay. And again, I'm a geriatrician. My medical practice is at the Atlanta VA. And some of the information that I'm going to share with you today is adapted from some publications from the Department of Veterans Affairs and also from the American Geriatric Society Health and Aging Foundation. So I wanted to start off, I don't have any conflicts of interest. I am going to discuss medications today. I don't get paid by any pharmaceutical companies. In fact, they probably don't like me because I tell people to stop taking extra medicines. The views I'm expressing today are my own. They don't represent the federal government. And the content here is not to be taken as medical advice. This is informational. Each of you is unique. So please consult with your own healthcare professional for any medical questions. As I like to say, I am a doctor, but I'm not your doctor. So I will do my best to educate, but please consult with your own healthcare professional that knows you well for any personal questions. So wanted to talk about something that's near and dear to my heart, my area of real interest in caring for older adults is about taking medications safely, safe prescribing, and avoiding unnecessary medications or adverse events from medications. So when we're talking about medications, what does that include? So it includes what you probably think of as your prescription, something that a provider has prescribed, and this can be everything from pills to inhalers, injections, patches, creams, eye drops. Those can all be prescription. And then there's, of course, over-the-counter medications that you may be taking. And that's, of course, runs the gamut too, the pills, liquids, creams, eye drops, patches, there's all kinds out there now. And then also, importantly, to include the other things you put in your body, any vitamins, herbal supplements, or other health supplements that you may be taking. So when we talk about medications, just a little bit of clarification that dietary supplements, which includes vitamins, herbal products, and any other supplements, are not really considered drugs because they're not intended to prevent or treat a disease. So these products are really intended to maintain or improve your health, and they may help you meet your daily requirements for vitamins and minerals. So we'll talk a little bit more about that, about the difference between prescription medications, over-the-counter medications, and then vitamins, herbs, and supplements. So as Dr. Parker mentioned, what is polypharmacy? It just means the use of multiple medications. And most older adults, adults 65 and older in the United States, take multiple medications. We use a lot of medications in our country. And so, medications in themselves are not bad. I mean, modern science has come up with more medicines than we've ever had before. There's more medications available than ever before, and people are living longer. And so we tend to be diagnosed with more diseases the longer we live. And so we collect those diagnoses, and along with them comes often medications for those diagnoses. So as we get older, we tend to take more and more medications. And with living longer and more diseases, we end up with more medicines. And guidelines telling doctors and other prescribers how to best care for different diseases, they often tell them when they should start a medicine, but they rarely mention when they should stop a medicine. And so we really have a culture of adding medications, in the United States, and we tend to do that before we try non-drug solutions like exercise or physical therapy for many things. So there may be non-medication treatments that might work better or just as well as medications that we often overlook. Instead we just take a pill. And people may not know about the risks of the medications they're taking. They may not be well informed by their doctor or their pharmacist. And patients may not feel empowered to speak up for themselves or to ask questions, to advocate for themselves. So I want to, hopefully after this discussion, you will all feel empowered to advocate for your health. And so I just want to point out, that more medications does not necessarily equate to a better quality of life. So really important, geriatrics is a specialty, kind of like pediatrics, because we know young people have medical conditions different than older people, and older adults have medical conditions different than young adults. And so as we age, we actually really do become more sensitive to medications and medication side effects for various reasons. And with normal aging, our bodies change in the composition, which unfortunately we tend to gain fat and lose total body water. So we have more fat in our bodies, less water, and medications that may be absorbed into fat may stick around in our body for a long time. So that could actually make the concentration of the medication stay longer and increase the risk for side effects. And we also, as we normally age, things may change with how we absorb medications. Like in our digestive tract, we may absorb them more slowly or faster, and that makes a difference in how the medications reach the bloodstream. And then we may have changes in our body weight as we age that can definitely affect the amount of medications we need. And then our liver and kidneys do have some changes that are normal with aging. There's some slight decrease, especially in kidney function with age. That is a normal part of aging, but also very common is that people, as they age, may have other diseases that are affecting their kidneys or their liver. And that's how most medications get metabolized in our body. And so if our kidneys and or liver are not working 100%, we may have more difficulty excreting and metabolizing medications. And then interestingly, as we age, we also have changes in the chemical receptors in our body. And so those often will, you may have more or less of those chemical receptors, and that may make a difference in if medications have more or less activity depending on your age. So I want to take a moment to talk about adverse medication effects, because this is what we really worry about with taking medications. And while medications can certainly improve our health, if we're taking them incorrectly, or we're taking a lot of medications that might interact with each other, we can have adverse effects. And so we can suffer from things like over-medication, harmful drug interactions if we're taking multiple medications that interact. We may have under-medication if we're not taking the medications as prescribed, or perhaps we're taking something that's making it difficult for our body to absorb the medication. We may have side effects, and these can be anything from the expected side effects, like, this antibiotic may give you a little bit of upset stomach or may make you have a little bit of diarrhea, but keep taking it, until you're finished, to much more serious side effects, like you may become very confused, you may have falls, you may have an anaphylactic reaction. So there's a big spectrum of what kind of side effects you could have for medications. And then especially as we age and collect more diagnoses, more diseases, our medical providers may give us a medication to treat one condition, and it may inadvertently make another condition worse. So we really need to be on the lookout for that. And a similar issue is what we call prescribing cascades. And this is where you're given a medication to treat one condition and it causes a side effect, but you don't know that that side effect is from the medication. You think it's another medical condition. And so then you're given another medicine to treat the side effect of the first medicine. And this can kind of cascade into being multiple medications that you don't necessarily need, which of course puts you at risk for having even more side effects. So what kind of things increase the risk of adverse effects from medications? The number one thing is taking more medications. Just statistically, the more medicines you take, the more likely they are that some of those medications are going to interact with each other or have an effect on you personally. And so some examples of this, you could have one medication that makes another one not work as well, or you can have one medication make other medications work more based on whether they're blocking receptors or changing absorption of other medications. An example of that would be, like, you probably shouldn't take aspirin if you're taking a prescription blood thinner like warfarin, unless your healthcare professional tells you to. So you'd be on two medications that would both be causing risk for bleeding. And then another big thing that can increase adverse effects is pre-existing medical conditions. So this is when a condition you already have, say you already have high blood pressure, you already have diabetes, you have heart failure. Some medications can make those conditions worse. And so you need to be very careful that any new medications you take are not going to worsen your existing medical conditions. So a good example of that is if you have high blood pressure or asthma, you could have an unwanted reaction from taking just like an over-the-counter nasal decongestant from having a cold. It could raise your blood pressure or give you constriction of your airways. And what increases other things that increase the risk of adverse effects? This one's a little bit self-explanatory, but mixing alcohol with some medications. So alcohol is already a sedative. So if you're mixing that with certain medications, it could increase that effect, make you very sleepy or drowsy, slow your reaction times, and then certain foods. So this is an area where there's kind of a lot of considerations. Some medications will say take with food, some will say take on an empty stomach. It is important to look at those recommendations on your prescriptions because some medications won't be absorbed very well if you're taking it with food. And some medications, they recommend you take it with food so that it's absorbed better. So it's also very important that we think about some medications shouldn't be taken together with food or other supplements. So for example, antibiotics are a really good example of this. Some antibiotics aren't absorbed well if you have food or drinks or medicines in your system that contain calcium, magnesium, or iron. So things like antacids, vitamins, dairy products, those might keep you from absorbing your antibiotic well. Another big one is grapefruit juice. Many people take cholesterol-lowering medications called statins, and some of those medications have an interaction with grapefruit juice. Basically, the grapefruit blocks the action of an enzyme in the liver, and that enzyme usually helps break down that statin medicine. So if you're having a lot of grapefruit products, your statin medicine may not be metabolized like it should, and there may be higher levels in your blood. So it could give you higher than unwanted levels of medication, which could lead to side effects. And I wanted to point out specifically around brain health. Some medications alone or in combination can really impair and impact our balance, our memory, sleepiness, and other health conditions. So these are mostly going to be what we call anticholinergic medications. I'm going to explain that a little bit in a moment, but I just wanted to give you some common examples of medications that can really impact the brain. One is medications to treat bladder problems, especially for overactive bladder. So these are bladder relaxants. You may have heard of some of them like oxybutynin or tolterodine. Medications for sleep. So some of our antihistamines like doxalamine, hydroxyzine, diphenhydramine, which is also known as Benadryl, and benzodiazepines, such as alprazolam or Xanax, lorazepam or Ativan, clonazepam or Klonopin. Those are some common ones. And then what we call the Z drugs for sleep, things like zolpidem, which is marketed as Ambien, or esoclopin, which is Lunesta, and Zaloplan, which is Sonata. Those Z drugs also can cause memory impairment, sleepiness, and confusion. And then narcotic pain medications, things like hydrocodone, oxycodone. Some treatments for mood, specifically tricyclic antidepressants, and then some people take the benzodiazepines for anxiety, so like alprazolam, lorazepam, or clonazepam are some frequent ones. Medications for muscle relaxation, so the muscle relaxant cyclobenzaprine can really cause confusion. And then some over-the-counter medications like cold and flu medications that have antihistamines in them, like diphenhydramine, which is Benadryl. Benadryl is an ingredient in a lot of over-the-counter cold medications. So you really need to look to see what's in those medications. So I just want to give you an example here about how medications for one thing could affect something else. So I talked about the anticholinergic medications, which is a big word, but so some of the bladder medications that are helpful for overactive bladder, they temporarily relax the bladder muscle, make it stop contracting by acting on receptors in the bladder called cholinergic receptors. So I have a little drawing here kind of showing little medication molecules, and they attach to receptors in the bladder, and they help relax the bladder so you don't have as much gotta go. But these same cholinergic receptors are also involved in memory and thinking. And so when you take a drug, it's going through your bloodstream and going to your whole body. So it's not just affecting your bladder. Those same cholinergic receptors are also in your brain. And so that medication is acting on those receptors in your brain as well. And it's blocking acetylcholine in the brain. And that leads to confusion, delirium. And then also it's in other parts of the body where the side effects from those medications can be seen, like it can give you dry mouth and constipation. And that's all from the medicine acting on these receptors in other parts of the body. So while it's helping the bladder, it may be hurting the brain. So how do you know if a medication might have side effects? There is an evidence-based criteria that prescribers can reference, and this is called the American Geriatric Society, or AGS, BEERS criteria. This is updated periodically by experts, and it's based on scientific evidence. And the last update was in 2023. And this criteria was developed to reduce the use of medications that often result in more risks than benefits in older adults. And it lists medications and classes of medications that are potentially inappropriate for older people. And then it also has a list of medications that are potentially inappropriate for older people with certain health conditions. And so I do have a couple of QR codes throughout this talk, which you're welcome to link to, and then you'll also have access to the slides later. So what should you do if a medication that you're prescribed is on this AGS Beers criteria list? Well, healthcare professionals and older adults, they shouldn't make decisions about their medicines just based on this list. Everyone is different and responds differently to medications. And so, after careful consideration of risks and benefits, you and your healthcare provider might decide that a particular medication, even if it's on this list of being high risk for side effects, might be the best choice for you. And so it doesn't mean that you should never take these medications. It means that you should be very cautious about making sure it's the best choice. There might be alternative medications or alternative treatments with less risk of side effects. So here's part of my advocating for yourself. Whenever you get prescribed a new drug, ask questions. Ask your doctor, ask your pharmacist, what is this for? How do I know if it's working? What side effects should I look for? That's really important. How and when to take it? What should you do if you miss a dose? Asking if it's going to interact with the other drugs you're taking. I recommend that people try to get all of their medications from one pharmacy so that the pharmacist has a list in the computer of all the medicines you're taking, and that thanks to technology, there's computer programs that can alert them to potential interactions between medications. And they can also use that list to kind of run a review of your medications to see if there's any interactions. And is the drug going to affect any of your other medical conditions? Often older adults are going to multiple specialists and they may only address one organ. You have your heart doctor and your kidney doctor and your lung doctor, and they may not talk to each other or even really have a good idea of like the other medical conditions you have outside their specialty. So making sure that it's not going, any new medicine to address one issue isn't going to make another issue worse. So when I talk to folks about medications, I get a lot of questions about herbs, vitamins, and supplements. So I wanted to put in some information. Herbal products and supplements can affect the body just like prescription drugs. They can interact with each other. They could interact with your medications. They could affect the absorption or metabolism of other medications. And I just put here a few common supplements that you may be familiar with and some reasons that they could be harmful. So large doses of vitamin A can really worsen your bone health. Large doses of vitamin B6 can cause nerve pain. And then ginkgo biloba, St. John's wort, garlic, and fish oil all interact with blood thinning or anticoagulant medications and can increase bleeding risk. So it's really important that if you're taking any of these, that your prescribing providers are aware so they can make sure that there's no interactions or that maybe you need to come off of the supplements for safety. And then just a word about medical marijuana. It can have a lot of dangerous side effects, especially in frail older adults. So dizziness, disorientation, confusion, falls, hallucinations. So there's a lot of potential side effects there as well. So I wanted to mention how herbs, vitamins, and supplements are regulated differently than medications in the United States. So the U.S. Food and Drug Administration does not regulate herbal products, vitamins, and supplements in the same way. They do not look to see what's really in them. They don't look to see that they do anything. Basically, the FDA regulations, the only thing they regulate is that these products are being produced in a good production facility. So where they're being produced is like a clean facility. So you really need to check with your pharmacist or healthcare provider before starting a product to be sure it doesn't interact with other things you're taking. And how do you even know if what you're taking in a product, that a supplement or vitamin or herb that you're purchasing is really what's in there? I mean, they could be just selling you sawdust or whatever. There's no regulation at all. There are two independent companies that their certification gives you some assurance that the company was actually hired to do an independent review to show that the herbal product is actually contains what it says, and that it was manufactured with good manufacturing practices. And so if you're buying something, you want to look for a certification by the United States Pharmacopoeia or the NSF International on the label, and that will give you a little bit of assurance that it's probably contains some of what it says on the label. All right, because this is BrainTalk, I wanted to specifically address supplements for memory. So unfortunately, we don't have any high quality evidence that any ingredient sold as a dietary supplement improves memory or prevents the development of dementia. Despite this, the supplement industry makes billions of dollars a year selling supplements because people are very desperate for anything that might help their brain health or prevent dementia. And an example here is Prevagen. This is an over-the-counter supplement that claims to support brain health and boost your memory. It had a very, very aggressive advertising campaign. But unfortunately, the evidence about how well it works is really limited. And there's concerns whether our bodies can actually even absorb the ingredient that is in it, which is something called apoequorin, which you've probably seen the ads, but it's a protein that's found in jellyfish. It's actually manufactured. It's not that actually, they don't actually get it out of jellyfish. They artificially make it for this supplement. But like with many proteins, ingesting it, so if you're taking a pill that has this protein in it, your body is digesting it, and which means it's breaking down the proteins. And so it's probably not intact when it's circulating around in your body to actually do much. But again, we don't have a lot of scientific evidence on that. And just, Prevagen is not FDA approved for memory loss. It shouldn't be used if you have serious memory problems or Alzheimer's. In fact, in 2017, the Federal Trade Commission actually took legal action against the company that was marketing this supplement because the company was making false claims about how effective the supplement was, because it said it was clinically shown to improve memory and provide cognitive benefits. And in 2020, the company that markets Prevagen actually settled a lawsuit, and they're allowed to continue marketing the product, but they've had to clarify their language because they have now a disclaimer that's based on a clinical study of subgroups of individuals who were cognitively normal. So it was one very small study that was done by the people who make Prevagen. So, the evidence, unfortunately, is very limited for this. And another supplement I get asked a lot about for memory is ginkgo biloba. The safety and efficacy of ginkgo biloba for prevention of cognitive decline has been extensively studied, because we really want to find something that's going to help. And, although generally the supplement it does not cause serious side effects, it actually has been found to have no effect on cognitive function. So unfortunately, we don't have a silver bullet in any of the dietary supplements out there. So a word about deprescribing. Deprescribing is part of good prescribing. And deprescribing is planned and supervised process of dose reduction or stopping a medication that may be causing harm or is no longer of benefit. And so, I don't want you to go away from this session today saying, Dr. Mirk told me to stop taking all my medicines. No. Planned and supervised by your healthcare practitioner. But it is a good idea to go over all the medications you take and say, what is this for? Do I still need this? Is it really doing anything? Especially medications maybe started years ago to address a condition. Maybe the condition has resolved. Maybe that medicine really never did anything anyway. maybe you were started on it by, while you were in the hospital and you don't need it when you leave the hospital, but they still put it on your list. So really going through that list and making sure you actually need everything that's on there. And that goal for deprescribing really is to reduce harm or potential for harm in taking unnecessary medications or medications that are at too high of a dose, and reduce the burden on you, not only taking a lot of medications, but also the cost of extra medications that you don't need. And to really make sure we're maintaining a good quality of life without having to take more medications than necessary. So what can you do? Some practical tips. Keep track of your medications. Make a list. Keep a copy with you all the time. Keep it in your wallet. Keep it in your cell phone somewhere. And make sure somebody else has a copy too, or keep a copy in a safe place on your computer. And include the name of all your medications, the dose, the reason for it. Include all of the over-the-counter supplements, everything that you take. Update the list every time you have a change in your medications, and share that list with all of your providers. I mean, if you think that your doctors know what you're taking, they only know what's on the computer screen in front of them. All the different healthcare systems don't talk to each other. The pharmacies don't talk to each other. So, you really need to be your own advocate and be the person who knows what you're taking. You know what you're putting in your body every day. So you really need to share that accurate list with your providers. Check the expiration dates on your bottles and safely dispose of medications that have expired or that you no longer take. Really make sure you keep medications away from children. This includes teenagers, so for safety. And then, things following the instructions, taking medications at the same time every day, having a routine, have some system. A lot of people use a pill box to remember to take their medications, or, sometimes I'm brushing my teeth and I'm like, okay, did I take my pills or not? It was just 5 minutes ago. But if I have the pill box, I know, okay, Tuesday's empty, I took them. Make sure you report any suspected side effects. Really important, do not share your medicines with others. Okay, don't give your friend your pills you got for back pain when they have back pain. Everybody is unique. Everybody has their own medical issues. You don't know what other people's medical conditions are, their kidney function, their liver function, what medicines they're taking. It could be very dangerous to take a medication from someone else that's not prescribed. Speak up, report problems, let your doctor know if you have any trouble with your medications. There may be other treatments available. Maybe they could switch you to a different medication or find a non-medication treatment. Make sure you check with your provider before you stop the medications. A lot of medications need to be tapered or weaned off so you don't have withdrawal. So make sure that you're doing that again in a supervised way. And then be honest with your providers. How are you taking your medications? If you really miss your medicine all the time, or like, this medicine tastes bad, I don't like to take it. And when you go to see the doctor, they're like, oh, your diabetes isn't controlled. And they give you a second medicine, or they increase the dose of that medicine, but you weren't taking the medicine in the first place, then you're going to be over medicated. So, really be honest about what you're actually taking. And then be honest about your use of alcohol or recreational drugs so that your provider knows about any interactions they need to worry about. Summary. The more medicines you take, the more risk for adverse events. Confusion is a really common side effect of many medications. Keep a list of your medicines, update that list, share the list with all of your providers, and remember to speak up if you think your medications or your conditions are causing memory complaints or other side effects. And you are your best advocate. I have some trusted resources here that I recommend if you'd like more information. The healthandaging.org is an excellent source for information on many topics in aging. They have a really great breadth of resources on medication safety. And then Medline Plus is a government website. It's from the National Library of Medicine. And you can put in the names of any medications you're taking, any supplements, herbs, and search for information on those. That's going to be verified information. And then I just have our link for Emory here if you want information on our health and aging. And I think that's...
Thank you, Dr. Mirk. There are some questions that are in the chat, but Let me throw this one at you. There's a question about medication management. Is that not a service that a pharmacy can provide? You're at the VA. Will a pharmacist talk to you about your medications?
You can, like, if at the VA, we are very fortunate in that every primary care team and most of the specialist teams have a pharmacist on their team. And they are the experts in medication. They can go through all of your medication, do a medication review, make sure everything's safe, make sure it's dosed appropriately for your kidney function, your other issues. So asking for a pharmacist review is really helpful. You know, if you go to CVS or Publix, you can also ask the pharmacist there to review all of your medications. They have software to run a program that will look kind of at all of your medications for interactions.
Okay, folks, so instead of asking other people, ask your pharmacist to look at your medications and see about possible interactions. But on that note too, Dr. Mirk, you know, a lot of people listening to this may assume they're on too many medications and just, I'm going to stop this and I'm going to stop that. Can you advise them correctly, please?
Yes, do not stop anything without talking to your providers. Because again, you know, there may be medications that need to be tapered if they are going to be stopped, or that medication may be really critical to your health. And you want to kind of balance that out. If you feel like you're on too many medicines, that's another good reason to talk to your prescribers, talk to your pharmacist. Maybe there's some things that are maybe optional or no longer needed. And those would be the ones that you would make a plan with your prescriber to come off of, but don't stop them just cold turkey, because that could be problematic.
Now, there is a question under Q&A, and it says, how do our individual genetics alter our reactions to medications? I don't know. That's an interesting question. I'm not sure we can get that, but I'm gonna let you take a stab at it.
I can only answer that in a very general way because I'm not a geneticist, but we do have differences in like the number and level of receptors for different things in our bodies that are mostly genetic. And so there may be differences in how we process things. And so that's kind of part of precision medicine, which is a really new area of medicine where we kind of look at the individual person and how their body metabolizes. And we try to make a treatment plan specific for that person. So it's not quite prime time medicine yet, but it is something that's really being studied.
Mm-hmm. That's great. I'm trying to see if there are any more questions. There is a woman that has a question in the chat about research study medications. I don't know how best to answer that, but I think it's important that all of your providers know what medicines you're taking. So if you're in a research study, it's really important that you share with the people in the research study you're in what medications you're in. And hopefully you would have done that when you initially started, because some medications may be something that will not allow you to participate in certain research. And that's for a reason, because they're worried about interactions with the study drug. At the same time, however, your medical provider and your pharmacist should know that you are in a research study and you are on a research drug protocol. And you should probably make sure that those providers know what that is so that they can adjust medications accordingly. Do you have that happen often at the VA?
And so I know in the VA system, we have a flag on the chart that says this patient is enrolled in a research study, and it has the name and phone number of the contact of the study. So if we need to contact them. And I think there may be a similar process at Emory, but again, that's not going to be at every doctor you go to because they may not be in the same healthcare system as the research protocol is based at. So important that you let them know, I'm on a medication that may be for blood pressure or maybe placebo. And if they need to know, there should be a way for them to contact the study.
Okay, last question, Dr. Mirk, and thank you so much. You've been very, very helpful for us today. This was so helpful. I'm going to have it in an encore presentation next month or later on this summer. That was so good. Thank you, Dr. Mirk.